Welcome to Cohen in the City Suburban On Air. And Thursday, February 4th is World Cancer Day. And there's a lot of activities going on, even during COVID. Joining me right now to talk about it is Dr. Mark Basik, who's the president of the Scientific Advisory Committee of the Cancer Research Society and also a member of staff at the Jewish General Hospital, and Virginia Lee, who's the director of the Cedars CanSupport Cancer Care Mission. So, Dr. Basik, I was looking at some statistics that was sent by your office, and it said it's estimated that 225,000 Canadians would be diagnosed with cancer in 2020, but the new estimates are actually down from last year. But that's not a realistic sign, is it? I mean, we all assume that there's less people being diagnosed because they were afraid to go get tested. I mean, is that what we're looking at here?
Not only they're afraid to get tested, but there's actually less testing because of the closure of especially of screening. Things like colonoscopies, mammographies were really curtailed in a big way, especially during the first wave. The second wave a bit less, but as well. So it's not only that they're afraid, but they simply couldn't be tested. And there are lots of delays in all kinds of diagnostics and as well as treatment.
Yeah, I mean, I don't think any of us a year ago would have thought that we'd be talking about something like this on World Cancer Day. I know the pandemic had arrived last year, not in Montreal yet, but it had arrived, and look where we are now. And yes, I know people personally who are afraid to step foot in any medical institution. And Dr. Basik, this is very dangerous for people in terms of their health.
Yeah, it's dangerous for their health. And the truth is that the people are looking at this now, and there's some studies coming out that there's very little danger of actually certainly in cancer care, going to the hospitals where there's high quality cancer care. There are very few infections that happen there. Certainly from the patients, they even did an antibody test in Pennsylvania. They said the amount of patients that actually got the virus with an antibody test was zero. So over several months, so the risk is low. And however, patients are afraid, and that's where the virus, patients of the virus are in hospitals, but most of the time they're well separated from the oncology units. Not perfectly, but usually they are. So that's why the risk is actually very low. So I don't think it's a problem, but there's that perception.
Yes. Now, Virginia, the Cedars Cancer Institute does terrific work. I'm more accustomed to attending some of their society events, which of course have all been taken down because of COVID in the last year. But you have a very interesting event coming up online, free, via Zoom, on Thursday, February the 4th. Perhaps you could tell us a little bit about it.
Actually, yes. So we have on February 3rd, it's the World Cancer Day. And this was something that was created 21 years ago by the Union for International Cancer Control. So what we're doing in Montreal, it's a way to share the human experience of cancer, raise awareness. We want to inspire and to take action. And even though we're not on site, we do have a lot of virtual resources that are continuing. And at the MUHC Cedars CanSupport, we have this public lecture that's taking place this Thursday, February 4th from 7 to 9 p.m. People can register by going onto the website cansupport.ca /WCD 2021. And this is really in line with the World Cancer Day call to action. And this is a theme you'll see in the back this way, I am and I will. And it means I am a supporter and I will make a difference. So what this does is that we're all affected by cancer, whether we're a patient, a caregiver, a family member, a friend, a healthcare worker, a teacher, a student. We all have that responsibility to take action. And so what we have lined up in this event, in this public lecture, are experts who will be able to inspire us to take care of ourselves, to achieve this sense of empowerment so that we can go ahead and take action, and we can all, as a global initiative, which is what the World Cancer Day wants us to gain momentum on, is to be able to empower ourselves so that we can take action and join in continual research, improve patient services, clinical treatment. We can improve all that as a group. So this is what's happening on 7 to 9 p.m. this Thursday. And it's really bringing people together to share that experience. COVID doesn't take it away. It's to raise awareness and to bring people together so we can talk about cancer and its impact.
Dr. Basik, events like this, I think, are very important. What is your message to everybody out there on February 4th for World Cancer Day this year?
Well, there's several messages, but I think it's important what was just said now, because research is the way, as we've seen with COVID-19, research is the way to overcome the disease, right? With a super fast development of a vaccine. Similarly, in cancer, we need to do research. And it's been very difficult to raise monies, in fact, for cancer research in the past year. The usual events have not taken place. And that, in fact, also can lead to delays in cancer research. So I'd like to emphasize that we can't forget that this is the way to continue forward. It's to support research. That's one big message. The other message, of course, is that you should not be afraid to go and consult. And if you have any issues, to go for the test or consult your doctor if there are any problems that you have, health issues, so that we don't delay the diagnosis and we start treatment. Cancer did not take a vacation during the COVID-19 virus, right? So, and that's what I kept on repeating during the first wave, and I still repeat it. So we must not forget that it still is the #1 killer, and we have to take care of ourselves, as she said, and also not forget, as I said, research.
Yeah, absolutely. Virginia, I see the panelists. There's a psychologist, a dietitian, someone talking about music therapy, and then you have a patient testimonial. So you've really touched all the bases, and I think people will appreciate each one of what they have to say.
Exactly. We wanted to really cultivate and try to nourish the mind, the body, and the soul. So we will talk about why self-care is important and how it empowers all of us to be coming together. But you have to start from one person. You have to start with yourself. And sometimes it's really difficult to focus on yourself when there's like a whole bunch of things that's going on at the same time. So we do have the psychologist, the nutritionist, and the music therapist. And we have the patient testimonial is going to be Gwen Nakos, who is the founder of Cedars CanSupport 31 years ago. And she will be talking about how she is taking action. And the other speakers and the other panelists will be, it's about giving the people tools so that they can empower themselves. It's not a one size fit all. So what's going to be nice is that the panelists will talk about what are some of the myths that we're seeing outside. How do we search out for some websites that are reliable and which ones are not? How do we take care of ourselves in a very busy time when we're going through different treatments, appointments, galore when somebody's diagnosed? But it's not even just about the patient. It's even affecting, World Cancer Day is about affecting everybody. It's even cancer prevention. So, how do we take care of ourselves so that we reduce the impact and the incidence of new cancer diagnoses throughout the year? It's by wearing sunscreen, going for your prevention, self mammograms, and all of that. It means that we're all affected, and these panelists will talk about the importance of self-care. And I think Pasqualina Dr. Didio will be talking about some of the research that she also participates in. So I agree. My background is in research. I agree completely that research cannot be forgotten in this, and it is sometimes, it's what drives improvements and advances in patient care and treatments.
Thank you, Dr. Basik. I read in the press release that your organization put out that the delays for some people had a direct effect on mental health. I can only imagine people who have cancer, think they have cancer, have the symptoms, won't go in. That's something else that we've had to deal with this year. connection, and haven't heard a lot about mental health connected to cancer, but of course it's definitely there.
Yeah, no, there's no doubt that if you have a history of cancer, and anything, the way you look at your body is very different. You're much more attuned and perhaps much more anxious about things. And then this happens, this COVID-19 pandemic comes, and it makes it much more difficult to allay the anxiety, to go and consult, in fact, the physician or the health provider to deal with these issues. So totally agree. Besides the fact of the patients under active treatment coming into the hospital and worried because they might be at greater risk because of their chemotherapy should they get COVID to do worse. So yeah, there's no doubt that that's a very big part of what has happened in the last 12 months.
And of course, one thing we've seen in the last year is that every doctor is now connected to COVID in some way. It's affected everything you do. I saw a video recently where you had to stop research and then you were able to restart it. So that has an impact as well.
Yeah, totally. As I said earlier, yeah, not only is the funding for research down, but over several months we had to stop very, very valuable research looking for novel treatments into cancer. And we started, we lost 4 to 5 months, and then we restarted from scratch in many cases. So yeah, it's had a very, very profound effect. The important thing is to continue that research, and the Cancer Research Society luckily has been able to, in fact, continue funding a lot of its research, a lot of the new research. In fact, they gave out over 70 new grants last year, and they were able to manage that. But that can't continue in an environment where the funding is decreasing. So we really have to become aware of that.
Very interesting. So Veronica, my last question for you is, I see that the seminar webinar will be bilingual, and I will say there's been a lot of webinars like this since the pandemic started. They're very popular, very successful, and in fact, I think when COVID is gone, we'll probably still see this format on the agenda.
I think one of the nice things that we've been seeing is that this increases the accessibility of cancer support services for a lot of the patients and the families and the caregivers. Sometimes it's difficult to go on site. So I think we're going to be looking towards making hybrid models of support services and programs and workshops and different kinds of activities. And we'll see how we can adjust ourselves. I think this is really a new way of working. There's advantages and challenges, but we're learning as we go along. So I think it's this is something that we're going to be adjusting as we go along with the COVID.
Absolutely. Well, I want to thank you both for joining me, and keep up the great work and stay safe.
Thank you, Mike.
Thank you.
Thank
Thank
you,
you, Virginia.
Thank you.
Great having these two guests with us today.